Go, Chantal.
Oh, it already, okay. Good evening. Welcome to the Eastern Ontario Health Unit's Ask Dr. Paul Facebook Live event. Dr. Paul Remiliotis, Medical Officer of Health, is on live again to answer your questions related to gatherings, group activities, and getting ready for fall. Bonsoir. Bienvenue à l'émission du Bureau de santé de l'Est de l'Ontario. Dr. Paul à l'écoute sur le Facebook Live. Le Dr. Paul Remiliotis, médecin hygiéniste, est là en direct, encore une fois, pour répondre à vos questions sur les rassemblements, les activités de groupe et les préparatifs d'automne. My name is Chantal and I will be your moderator. Participants watching can submit their questions in the comment box. We will try to address as many questions as possible. However, we will give priority to questions from the public and those directly related to tonight's theme. We reserve the right to remove any comments that are abusive or include profanity. Je m'appelle Chantal et je suis la modératrice. Les participants présents peuvent poser leurs questions dans la boîte de commentaires. Nous allons tenter de répondre au plus de questions possibles. Cependant, la priorité sera donnée aux questions associées directement au thème choisi et posées par les membres du public. Nous nous réservons le droit de supprimer tout commentaire abusif, incluant la profanité. We will now begin. Nous allons maintenant commencer. Good evening. Bonsoir, Dr. Paul.
Good evening, everyone. Bonsoir tout le monde. Another third one that we're doing, and I'd like to again welcome everybody. I know it's been different times for us, and I'm not gonna really talk much now about things that are going on. I think a lot of the questions will answer them. As you do know, we have been getting some increased case activity in Canada and in our area as well. So far, schools have started with no problems in our area, but we're continuing to work with our school boards. Donc, bonsoir tout le monde. C'est le troisième qu'on fait. Ça me fait plaisir d'être ici. En effet, je vais essayer de répondre la plupart de vos questions. Par contre, j'aimerais juste dire un peu que on est en train de voir des cas augmentants dans notre région et aussi à travers de Canada et Ontario. Mais on a commencé l'école il y a à peu près une semaine, donc pour le moment, tout va bien. Donc, on va continuer. Et il y a d'autres, je suis sûr qu'il y a d'autres thèmes au niveau des testings que je vais répondre, au niveau des questions qui vont venir. So, Chantal, let's move on with questions, please.
Perfect. Okay, so we've received a variety of questions tonight from the public in advance, and we already have some questions coming in through the chat box. We'll start with the ones that are specifically related to gatherings and group activities, and if time permits, we will try to address some of the other questions that are maybe a little outside the theme. Donc, merci. On a reçu une variété de questions du public, et on va commencer au début avec les questions qu'on a reçues qui pertinent vraiment au thème de ce soir. Puis si le temps le permet, on va essayer d'adresser les autres questions qui sont un petit peu à l'extérieur du thème. So the first one, Dr. Paul, is really related to group activities, and we had someone asking, is it safe to go to a dance class if we're practicing social distancing?
That's a good question. Essentially, it's like going to a gym, going to a yoga class. If you're practicing social distancing and you're not partnering with people that are outside of if you're doing, close dancing with two partners, for example, like a waltz or anything like that, unless that individual is your person in your bubble, you shouldn't be doing that. So yes, it is safe as long as you social distance, but make sure that you screen at the door, make sure people don't go when they're sick, wash your hands, and so on. So it is a safe activity, just like a yoga class or a gym class. Je vais répéter en français la question, est-ce qu'on pourrait aller aux classes de danse? Est-ce que c'est sécure si on practice la distance physique? La réponse est oui, c'est comme on a une classe de yoga ou une classe de gymnastique. Par contre, il faut maintenir toujours la distance de 2 mètres, laver nos mains, et éviter de danser avec les partenaires de proches comme une waltz ou un tango, sauf si cette personne est dans votre cercle social ou vit avec vous, etc. Donc, c'est permis, mais toujours, il faut laver les mains, il faut respecter la distance et aussi, très importante, d'être sûr que le monde qui rentre, on fait un dépistage avant qu'ils rentrent dans la classe pour être sûr qu'ils ne sont pas malades.
Perfect. Thank you, Dr. Paul. So we'll go right into a question from somebody on the live call. We have William James McLean who's asking, do the new restrictions that were announced by Premier Ford apply to our region? And he wants to know, especially for Wendover.
Yes, that's a very good question. The restrictions to gatherings are now effective tomorrow morning, actually. They will only apply to the Ottawa area, Toronto area, and Peel areas. And so they will not apply to the Prescott Russell, SD&G, and Cornwall area, in other words, the area of the East Ontario Health Unit. However, we are looking into, based on our case numbers, that it may, in addition, we may add East Ontario Health Unit area because it's very close to Ottawa. But at this point, the restrictions are only for Ottawa, Toronto, and Peel, and not in our area. However, that doesn't mean that we should not be careful when we gather in the numbers that we are allowed in our area. Again, respecting physical distancing, very important. Donc, la question est, est-ce que les mesures qui sont annoncées aujourd'hui pour limiter le chiffre qui pourrait avoir des rassemblements publics, est-ce que c'est pertinent pour la région de Prescott Russell, SD&G et Cornwall, la région de bureau de santé de l'Est d'Ontario? La question est non. La réponse est non. En effet, c'est trois villes uniques, Ottawa, la ville d'Ottawa, la ville de Toronto et la ville de Peel. C'est les trois régions seulement. Par contre, on est en train de discuter avec le ministère pour voir, parce que nous, on voit nos cas augmentant. Nous avons aussi des personnes qui ont attrapé le virus avec des parties privées. Donc, on est en train de voir si, à un moment donné, on aurait besoin de faire la même chose dans notre région. Pour le moment, la limite ne s'applique pas chez nous. La limite est toujours 50 à l'intérieur, 100 à l'extérieur. Par contre, il faut faire attention qu'on fait les distances physiques lorsqu'on fait ce type d'événements, parce que nous avons, même dans notre région, des personnes qui ont attrapé le virus pendant tout type des événements, comme les parties, etc., où une personne était malade et a infecté plusieurs autres.
Great. Thanks, Dr. Paul. We have a couple of follow-ups to this question. So actually a follow-up from the original person who asked, William James McLean. He just wants to know, when will we know about these new restrictions if the order applies to our region? Because if somebody has something planned this weekend for an indoor or outdoor event, like, will that impact them this weekend?
That's a good question. We're now looking at that. Likely, it's going to go into effect next week because we won't have time to put it into play. We're going to give a bit of a grace. But however, like I said, we're negotiating with the government, and it depends. If the government includes us, it will likely be effective into next week. This weekend, we're not going to put it in right away. It's going to go for next weekend if we do it, or if the provincial government decides to add it on to Ottawa because we're so close.
Great. Thank you, Dr. Paul. Again, another follow-up on the same topic. So there's several people in the chat box asking why the sudden shift to want to have the same types of restrictions as Ottawa. We've always been the same distance from Ottawa, and we've never had a spike in cases like they have, despite the fact that we're close to them. And so they want to know, why are we now looking at having stricter restrictions on our region, even though we're not seeing the same kind of case numbers as Ottawa?
Several reasons. Number one, we have been getting clusters of cases in our area that have been related to parties and those type of things. Over the last month, we've had close to 50 cases in 1 month. And to bring into context, the previous 2 months, we had 7 or 8 per month. And so we are seeing a peak of cases in our area, although it's not to the point where we had seen continual increase, but we are seeing it, particularly since the middle of August. That's one reason. The other reason, like I said, we've seen cases where individuals have been having multiple people in parties with a lot of people, not physically distancing because they weren't monitored. And thirdly, we are seeing a lot of cases. A lot of people live in Ottawa, work in our area, and vice versa as well. So those are the majority of the reasons we wanted to keep it that way. And yes, we are getting cases. It's not 1 or 2. We've had, like I said, a spike over the last couple of weeks.
Perfect. Thank you, Dr. Paul.
Je vais le faire en français aussi.
Oh, oui.
La question est pourquoi est-ce que dans la région du Prescott Russell, SD&G et Cornwall, on veut avoir les mêmes restrictions qui ont été mises en place aujourd'hui, évidemment parce qu'on n'a pas des cas dans notre région. En effet, nous avons une augmentation importante des cas. Je peux vous dire que le chiffre des cas que nous avons en mois de septembre déjà est plus que celui-là qu'on avait en mois d'août. En total, depuis le mi-août, on a une quarantaine, 45 cas. Et si vous comparez le mois de juillet et juin, on avait comme 7 cas, je pense, par mois. Donc, au niveau des chiffres, on commence à avoir une augmentation dans notre région. Deuxièmement, nous aussi, on a des cas de laquelle étaient en contact où la source était une partie avec plusieurs personnes, 30, 40 personnes, sans distance physique dans notre région. Et finalement, Ottawa est très proche de nous. Nous avons, la plupart de nos cas sont à Prescott Russell aussi. Par contre, on voit des cas à travers de notre région. Beaucoup des gens, c'est une va-et-vient important dans toutes les régions. Et nous avons beaucoup de personnes en effet, qui travaillent à Ottawa, mais demeurent dans notre région. C'est pour ça la raison pour laquelle on est en train de voir pour avoir un alignement avec les limitations qu'on voit à Ottawa aussi. En effet, ce n'est pas fait encore. On est en train de le voir. On est en train de voir nos cas. Déjà aujourd'hui, on a eu nos premières hospitalisations depuis quelques mois.
Great. So we're going to shift gears a little bit. We have a question that came in earlier today from a co-parent of a young school-age child. And they're asking, what will your recommendations be for both parents who have their own separate bubbles, as well as for their child, if they're starting to look at future gatherings coming up, such as birthday parties, Thanksgiving, Christmas holidays? So they're saying the child currently has quite a large bubble, unfortunately, due to circumstances of shared custody, and also because of being back to school. So they're trying to figure out how to do this in the best way possible, being safe for everyone involved, especially as we're seeing a resurgence of more cases.
Yeah, it's a very complicated question. It's a very complicated situation. I think that what we need to do is we need to keep the numbers as low as possible and try to limit sort of opening that circle. I know that they have a fixed circle right now, and it's again circumstances beyond their control because they have separated families and so on. I think they should limit them to identify individuals that are part of the two families or two sets and only limit it to that. And obviously be very careful with symptoms and be very careful with physical distancing when they believe that they're adding to that circle, which is not part of their own. So I do understand the concern, but what I would do is I would sit down and really identify exactly who's in the circle and keep it at that. The less, the better.
En français?
Répétez-moi la question en français, j'ai oublié.
C'est une famille séparée, donc les deux parents puis veulent essayer de naviguer la saison des rassemblements comme les fêtes, Noël, l'Action de grâce, puis comment faire ça de façon sécuritaire, puis aussi pour essayer de limiter les contacts.
OK. Premièrement, au niveau des contacts, comme je dis, je comprends que c'est des circonstances hors de leur contrôle, en effet, mais on a un cercle qui doit être respecté, qu'on augmente. Si c'est pour avoir des rassemblements avec d'autres personnes, là, il faut le limiter le plus possible. Par contre, si on a à visiter, c'est toujours les distances physiques, le port des masques, etc., sera très importante. And this now, I'm going to switch it to English because it leads me to Halloween, Thanksgiving, and Remembrance Day and Christmas as it's coming. We are going to be actually putting together some protocols and some guidelines as to safe Halloween, Thanksgiving Day, Remembrance Day, about how to do the memorials safely. They're forthcoming. Je voudrais juste dire aussi, parce qu'on est en train de préparer des guidances pour Halloween, Action de grâce et aussi pour le jour de le mémorial, Remembrance Day. Donc, encore tous les mêmes principes physiques, diminuer le plus possible distance physique, masque, et laver les mains et aussi de rassurer qu'on n'est pas malade quand on assiste à ce type d'événements.
Wonderful. Thanks, Dr. Paul. So we're going to go back to a question that's in the chat box. It's also a question that we've heard from several people over the last few weeks. And this one comes, though, from Giselle Rouleau. And so she wants to know if you can clarify why we're limiting our social gatherings to less people. Meanwhile, children are going back to daycare and schools where physical distancing is difficult and not always happening. So can you explain where, I guess, the discrepancy that some people might be seeing between saying that we shouldn't gather, but then kids are going back to school?
Okay, well, first of all, major differences. Number one, what we're talking about, we're only talking about limiting, and again, it's not imposed in our area yet, but in the Ottawa and Toronto. But the thinking is that this is only for what we call private, not monitored, not supervised situations. So you can ask me the same. So why aren't you doing it in restaurants? Why aren't you doing it in cinemas? Why aren't you doing it there? Why aren't you doing it in businesses? Well, we're not doing it in businesses because, like schools, there are procedures in place. There are mandates in place for screening people, for ensuring that masks are worn, for ensuring physical distancing as much as possible, for cohorting. There's a whole protocol in place and measures are in place. Unlike if you have 30 people in your backyard or 30 people in your basement. That's the difference. So we're only targeting at this point where we've seen the biggest number of cases come out, which is really these unsupervised, unmonitored private party situations where people are mingling together, not socially distancing, not masking, and infecting each other. And that's the difference. And so we have not seen any cases in businesses or in theaters or anything like that, except the sporadic one. But really, by and large, our restaurants and our other areas where the management is responsible for taking the names of people down, ensuring that they don't have symptoms when they come in, and those type of things, which are not happening in a private setting, but which are happening in the schools. So that's the major difference there. Je vais répéter en français parce que c'est une bonne question. On est en train de parler au niveau des rassemblements publics. On va les diminuer. Par contre, on laisse les enfants dans une classe. On voit aussi les personnes, les restaurants, etc., qui ont beaucoup de gens. En effet, c'est une bonne question, mais j'ai la réponse. Au niveau, la raison pour laquelle on veut limiter, en effet, c'est ciblé. C'est pas les rassemblements, tous les rassemblements. Ceci exclut les rassemblements des affaires au niveau des restaurants, le cinéma et l'école aussi, parce que ces dernières, ensemble, ont des précautions en place. On a mandaté les précautions en place, le dépistage des personnes qui rentrent, le port des masques, la distance physique, le lavage des mains, toutes sortes de protocoles sont en place, et aussi dans les écoles, en effet, et aussi dans les restaurants, dans les cinémas, etc. Ceci n'est pas le cas si j'ai une partie, ou quelqu'un dans une partie privée chez lui qui rentre 30 personnes, qui n'a pas de distance physique, qui n'a pas de masque, et pas de lavage des mains, on demande, on ne fait pas de dépistage des personnes qui sont malades. Toutes ces précautions ne sont pas là. C'est pour ça qu'on cible ce type d'événement seulement. On ne parle pas de diminuer le rassemblement dans les autres places comme les restaurants ou les cinémas ou les récréations sportives, etc. Parce qu'on a des personnes qui sont en charge pour superviser les gens et surveiller que les gens pratiquent toutes les précautions de santé publique.
Great. Thank you, Dr. Paul. So one more question related to this announcement that came out today about the gathering. So Terry Reed asks, so if we end up having to follow the same restrictions as that were announced for Ottawa, does this impact our 10-person family or social circle, or the bubble that some people have been calling it?
That's a very good question, and I can tell you that it will not impact it at all. We are talking about physical gatherings, public gatherings outside of your social bubble. That's what we're talking about. So we're talking about events where people would, go into a park or have other people in your home. You can't have more. You can't in your home. No, you can't. It won't interfere with your bubble. The bubble stays the same. Le cercle social va rester le même. En effet, c'est plutôt au niveau des personnes qui sont en dehors de votre cercle social, lesquels il va y avoir une limite. au niveau de rassemblage. Donc, en effet, maintenant, on a 50 personnes dans l'intérieur et 100 personnes à l'extérieur dans notre région. Mais ceci exclut les personnes de votre cercle social, parce que avec les personnes de votre cercle social, vous ne devez pas, vous n'avez pas d'obligation d'avoir une distance physique. Mais autrement dit, les sexes sociaux sont les mêmes.
Perfect. Great. We're going to shift gears a little bit. It's going to be a little bit off of the topic of gatherings, but I think it's relevant. It's very topical because it's all over the news, but it has to do with testing capacity. So we're getting a lot of people asking questions. Are there plans for more mobile testing sites in our region specifically? Because we've heard that there's lots of people being turned away or there's long lineups. And so people are just wondering, are there plans in the making for more testing, restricting it to individuals who are from our region, etc.?
Yeah, we have noticed, and this is not just us, it's across Ontario, actually in Quebec as well. There's been a much increased demand for testing. This is due to the fact that we have had schools open and a lot of people are going to get their kids tested. And we have opened it up to people who have no symptoms at all and just go and get tested because they want to get tested. And so we're experiencing a heavy lineup, and we're also getting in our area, particularly in our Castleman and our Winchester offices, we're getting a lot of people from Ottawa as well, because they're also overwhelmed as well. So we do recognize that. We do not have an intention of limiting it to people from Ottawa. We are working with everybody. We're Ontarian, so we're trying to support everybody as much as we can. But we do understand that we're turning some people away. Because we've been overwhelmed. So there's a couple of things. So there is a light at the end of the tunnel. And so one of the things that we're saying is right now, ourselves, Ottawa, Leeds, Grenville, and Renfrew, all the health units, the 4 health units in the eastern area here, we're now preferring and recommending that only people who have symptoms or who have been sent by public health because they've been in contact are to be tested. We're now trying to limit the number of people that are not symptomatic, who have no symptoms, no contact, because we want to give priority to the individuals that are symptomatic. So that's number one. That's a temporary measure. The good news is that there will be an announcement in the coming week that the government has made an agreement with several chains of pharmacies that will actually be offering at thousands of outlets across Ontario, testing for asymptomatic individuals. So that's going to take a bit of the pressure off and give an alternative to individuals to go. If they don't have symptoms, they can go there. And people who are symptomatic will continue to go to our assessment centers. We're also working with our EMS and our paramedic partners, and they have mobile units that can go and be deployed. For example, if we need to go into a school, into a workplace, they're doing it already for us when we do long-term care facilities. So we do have that. We're trying to increase our capacity because the hospitals and us who are manning the assessment centers don't have enough human resources. And so what we're doing is we're working with Ottawa now and seeing what we can do. Ottawa is putting up a few others as well. They're having some pop-up testing as well to relieve the congestion. And from our point of view, we also, in our area, in our Castleman office, which is a very popular drive-through, our capacity is limited to about 200, 250 cars just because we don't have the physical room for the cars. And so the other day we did 444 in Castleman, which is a miracle, which is amazing. But there was lineups all the way, kilometers down. And so that's not safe. So what we're doing for the Castleman office is that we're going to be moving it to a site on the 417, which will be a much bigger site. So we'll be able to drain a bigger area. So all this to say that there will be a much more robust availability of testing literally over the next couple of weeks. And in the interim, we're asking people who don't have symptoms and don't need to be tested not to come to be tested, because we're prioritizing the people that have symptoms, and particularly the young kids. Donc la question est, est-ce qu'on voit Au niveau des centres de dépistage, du testing, on a beaucoup de gens qui attendent et des fois, ils sont refusés parce qu'on a débordé. C'est un phénomène qu'on voit à travers l'Ontario, en Ottawa, même à Québec aussi. C'est parce on a vraiment, on voit actuellement une augmentation du besoin du testing. Et en effet, ceci est expliqué en particulier parce que on a maintenant les écoles ont commencé, donc beaucoup des enfants qui vont venir d'être testés. Deuxièmement, on a des personnes qui n'ont pas de symptômes et même pas le contact, mais veulent tester parce qu'ils voudraient être sûrs qu'ils n'ont pas la maladie. Comme première chose qu'on va faire, en attendant qu'on a qu'on augmente notre capacité et offrir d'autres lieux pour du dépistage, on demande les gens qui n'ont pas de symptômes, qui n'étaient pas demandés d'aller par santé publique d'être testés, les gens qui n'ont aucun contact, de ne pas se présenter pour faire tester, pour laisser la place pour la priorité des enfants, les personnes qui sont symptomatiques, qui ont des symptômes. La bonne nouvelle, c'est que le gouvernement va annoncer bientôt, probablement la semaine prochaine, qu'il y a une entente avec plusieurs chaînes de pharmacie à travers l'Ontario qui vont être capables de offrir des tests dans les pharmacies. Apparemment, il va y avoir 1000 et plus à travers l'Ontario qui vont être capables de tester les gens qui n'ont pas de symptômes. Donc, à ce moment-là, ça va laisser un peu l'espace pour nos centres de dépistage pour faire uniquement les personnes qui ont des symptômes. Aussi, on a des équipes volantes par nos paramédics qui pourront aller faire un test dans une école ou une place ou même des foyers à longue durée qu'on fait déjà. Donc, on a ça. Et finalement, nos centres de dépistage de Castleman est débordé parce que c'est au volant, c'est très populaire. Et nous avons beaucoup de personnes d'Ottawa qui viennent aussi. Et en effet, on travaille avec nos confrères à Ottawa pour trouver les solutions à Ottawa en même chose parce qu'eux aussi, ils sont débordés. Et à Castleman, on n'a pas d'espace, c'est ça. Même si je mets plus des infirmières, on est limité au niveau des autos qui pourraient passer. L'autre jour, on a fait, c'est un miracle, on a fait 444 autos dans une journée. Mais la ligne était des kilomètres et il fallait qu'on appelle la police pour faire le trafic, etc. Donc, on est limité avec ça. Par contre, on est en train de préparer, de déménager nos centres de dépistage de Castleman sur le 417. Et ceci va servir un plus grand terrain et on va être capable d'augmenter nos capacités aussi.
Great, Dr. Paul. So just to continue on the theme of testing, and areas where lots of children are gathering, so daycare specifically, and schools. So we're getting a lot of feedback in the comments about right now, it's that time of year, it's fall, the weather is changing, it's hot, then it's cold, it's hot, it's cold, kids are dressed too hot, not hot enough. And so a lot of them are showing up with like a runny nose. And is it reasonable? A lot of people are asking, is it reasonable to expect that a child needs to get tested or get sent home every time they present at school or daycare with a runny nose?
Well, it's it's a good question. It's a complicated question. You know, we're now in a pandemic, so it's a different situation. And ordinarily, we wouldn't even be asking that question. The issue is that it's not automatic. And I've said that time before, it depends on the situation. It depends on the cause. If the child has allergies or other things, then those things are, if something else can explain it, then the child can continue to go to school, provided the symptoms, go away without getting tested. On the other hand, we're now moving forward to looking at situations and risks, and if the child has no other explanation, then it would be preferable for the child to be tested before the child is sent back to school. And again, this is extraordinary times because we're now in the middle of a pandemic, and the symptoms really cross over. We do recognize that. I'm hoping, and as we move forward, that we'll be able to do very quick tests, on-the-spot tests that will give us the solution. So this is, I think, a temporary issue and an issue that is exclusive because we're during a pandemic. And again, if there is a cause that we can find, allergies or other issues, at that point in time, then the child does not need to be tested. But if there isn't, and particularly if we have high rates as we do now, we would recommend testing. And this is why we want to prioritize our testing centers to be able to accommodate those children. And if we need to send a paramedic to test kids at school or whatever, we will do that. We will have mobile ability. So again, this is a temporary measure because we want to make sure that we're limiting any potential spread within the schools. And that's really part of the blanket of protection that we're offering. But I'm encouraged that very soon we'll be able to do those quick tests. Then we'll be able to test a child and get a result in about 15-20 minutes and then know what to do in that respect. Donc, c'est une bonne question que j'avais, c'est parce que, en effet, beaucoup des enfants, ce temps-ci, on a une rhume, on a un nez qui coule, et les parents se demandent à chaque fois que mon enfant est malade, pourquoi est-ce qu'il faut que je fasse le test, il faut tester l'enfant pour le COVID. Mais en effet, il faut dire aussi que normalement, on discuterait pas de ça parce qu'on ne sera pas dans une période pandémique, mais on est dans une pandémie à ce moment-là, et malheureusement, les symptômes sont semblables. Par contre, si on a une raison pour l'enfant, disons que l'enfant a des allergies ou une rhinite allergique ou de l'asthme, à ce moment-là, si on pourrait éliminer la possibilité de COVID, on n'aura pas besoin de faire le test pour l'enfant. Simplement, l'enfant reste à la maison jusqu'à temps qu'il n'y a pas de symptômes. Par contre, on recommande que l'enfant soit testé si on a des symptômes parce que on peut pas l'exclure, on peut pas l'éliminer. Il n'y a pas de moyen de l'éliminer juste en voyant l'enfant. Donc, on aura besoin de faire un test et que l'enfant reste à la maison jusqu'à temps que le test revienne. Par contre, je suis encouragé, donc c'est une chose temporaire, parce que moi, je suis encouragé. Bientôt, nous allons avoir des tests portatifs, instantanés. On fait le test, on aurait le résultat en dedans d'une demi-heure ou 45 minutes et on saurait si l'enfant a du COVID ou pas. Sinon, l'enfant resterait à la maison jusqu'à temps que les symptômes sont dépassés et il retourne à l'école. Donc, soyez un peu patiente et je pense qu'on aurait une moyenne plus efficace aussitôt qu'on aurait le nouveau test. Mais entre-temps, comme je vous l'ai dit, si on a une raison pour l'enfant qui explique les symptômes, on n'aura pas besoin de tester, mais sinon, on a besoin de le faire tester. Et ceci est une raison pour laquelle on demande que les gens qui n'ont pas besoin de tester, autrement qui n'ont pas de symptômes, ne se présentent pas dans nos centres de dépistage, qu'on pourrait faire priorité sur les enfants. Et aussi, si, disons qu'on aurait besoin d'aller tester quelques enfants à l'école, on a des équipes mobiles qui pourraient en faire aussi.
Great. Lots of chatter in the comment box about this discussion. Obviously, lots of what we're hearing, and obviously, I'm sure you empathize. Like you said, parents need to be patient, but I think a lot of the fear and the stress is because right now a lot of parents are having to take time off every time their child has a runny nose. Some are commenting that, you know, because of a child's runny nose, they've had to go get tested. They're waiting 4 or 5 days. And so that time has away from work has created some additional stressors. So just wondering if there's anything more we can say. I know we're asking people to be patient. Somebody else just asked, the portable tests or the saliva test, when can we expect that to come? Lots of excitement for that.
Me too. I'm excited for that. I believe you, me.
Yeah.
Well, look, I do understand. And, you know, one of the things that we're trying to do is we're trying to be as logical as possible here. So depending on the situation, like we still have we have a caseload, but we're not like super red zone or hot zone. So in this situation, what we're doing is obviously, because the other situation is, aside from going to take time to test, during a hot zone situation, if we have a lot of cases, ordinarily what would say is that the household contacts of that individual should stay home, not go to work until that individual tests come back, right? But what we're saying now, because we're not in that red zone yet, you know, a higher zone, although we are increasing the cases, at this point in time, what we're saying is if your child comes home and is tested and you're waiting for a test, the household contacts, including siblings, provided they're well, and parents, can resume their activities, can go to work as we're waiting for the tests, provided they can take they're not sick and they can take the appropriate measures, wear masks, at work, and of course, physical distance. So again, I understand there is it's causing a lot of stress, but we're trying to work as much as possible to find a logical way that will balance the need for for parents to stay home or limit that time. And as we get the testing better, as we get the testing more efficient, both in terms of decreasing the lineups, because we have more availability, and as soon as the instantaneous test comes back, it'll be a much better and a much more effective and less stressful time. Donc en français, je veux dire, la question, c'est que les parents sont frustrés et sont stressés parce que si un enfant est malade, un nez qui coule, il rentre à la maison, il faut aller tester, attendre pour être testé, et des fois, reste à la maison jusqu'à temps que le test revienne. Les parents peut-être pourraient pas aller travailler parce qu'ils sont isolés, etc. Donc, je comprends que c'est une inconvénience importante et un stress très important. Par contre, nous essayons de trouver une solution le plus logique possible. Premièrement, si un enfant reste à la maison, en attendant, il va rester à la maison en attendant d'un test. Pour cette période, ce temps-ci, les parents n'ont pas besoin de rester à la maison isolés. Ils pourraient aller travailler tant qu'on a quelqu'un pour garder l'enfant à la maison, dépendamment de l'âge d'enfant, par exemple. Et les frères et sœurs de l'enfant pourront retourner à l'école en attendant que le test de l'enfant qui était testé. Faut dire aussi que, évidemment, les personnes pourraient retourner au travailler en attendant, pas l'enfant qui était testé, les autres de la maison, tant qu'ils n'ont pas de symptômes et tant qu'ils pourront respecter porter des masques, etc. Donc, on essaie à faire le moins d'inconvéniences possible. En attendant, premièrement, nous allons acheminer le testing, que ça soit fait le plus vite possible, d'avoir moins des foules qui attendent avec toutes les autres mesures qu'on va faire dorénavant, et aussi d'attendre aussi avec les tests instantanés, qui, à mon avis, va changer tout ça. Ça va être beaucoup plus simple, beaucoup efficace et beaucoup plus vite pour avoir une décision de oui, l'enfant a du COVID ou pas et qu'est-ce qu'on fait en conséquence.
Thanks. So we're going to keep on the theme of testing just because there's lots of questions still related to testing. Some of it, I think, is maybe some misunderstandings or some confusion or clarity, looking for clarity about what happens if a child does test negative. So Sarah Blaney's asking, if a child tests negative with a runny nose symptom, why would they need to continue to stay home until they are symptom-free? So can you explain that? Because I think a lot of people are really confused about that part of the mandate.
What we're doing is that this is a change. This is something that's changed recently in terms of our recommendation. As long as the child has no fever and is improving, then we will allow the child to go back to school. This is a new protocol that we put in place. That is a new guideline. However, we do want, because the other thing is that what's the other cause? So right now we want to see improvement, and we know that at the end of an improvement, a child is not contagious. Because don't forget, kids can also have colds due to 200 other viruses. So in general, we don't want to send kids to school if they're sick, regardless of COVID. It's the same approach. However, what we're saying is that as long as we're seeing improvement in the symptoms, we know that the kids are much less contagious, so they can go with a bit of a runny nose or perhaps a cough that's kind of, so some kids can get what's called a post-viral cough. That's not a reason not to go. So what I'm saying is that it's more, our usual thing is if you've got any child that has sick and is potentially contagious with anything, we try to keep them home until we are assured that they're not contagious anymore. And that's usually towards, as they start getting better, towards the 24 hours when they start getting better. So we're changing a bit the guideline in terms of seeing improvement, but certainly no fever for 24 hours. Au niveau de retour dans la classe, si l'enfant est négatif, on dit d'attendre 24 heures sans, de ne pas avoir de symptômes avant que l'enfant doit retourner. Sûrement, si 24 heures sans la fièvre, premièrement. Et là, on a changé un peu la procédure pour voir si l'enfant est amélioré, malgré que le nez coule un petit peu ou il tousse un petit peu, il peut retourner à l'école. Par contre, la raison pour laquelle on dit qu'il faut avoir vraiment une guérison, parce que vraiment, à la fin d'une maladie, même si on a un peu de symptômes, on est contagieux, on est moins contagieux qu'on était au début. C'est pour ça que même dans un temps normal, quand on n'a pas de pandémie, on ne veut pas envoyer un enfant à l'école ou à la garderie parce qu'il y a d'autres virus qui pourraient être propagés dans l'école aussi.
Thanks, Dr. Paul. So we're going to shift gears a little bit back to gatherings. So Tammy Lynn Zollinger asks, have you considered the mental health impacts in your decision to further shut down gathering numbers?
First of all, the gathering numbers are limited to those private settings, not limited to others. So it's not like it was before. Before it was everywhere. And theaters were closed, movies were closed. Nothing stops individuals from, going out, to restaurants and those type of things. Nothing stops it. This is a completely different situation. Yes, I've thought about the mental health of it as well. However, I think that you still can gather. You will be able to gather. Again, we haven't implemented in our area, but it's not the same as we had before, where you had 5 that anywhere, and everything else was closed. But movie theaters are open, sports are open, everything is open, and those numbers have not changed. As long you can go to those areas, and the limits don't apply. Those new limits that are put in don't apply there. You can go and go to a restaurant, go and participate in an event or whatever. That is excluded. We're only limiting it to those backyard, really private parties where there is no supervision. So that's what I want to say. So I don't think it'll affect the mental health as much as it did if we were to say everything is down to 10, or down. So la question, est-ce qu'on prend les conséquences de santé mentale en diminuant le chiffre avec lequel on pourrait faire des rassemblements? Premièrement, on ne le fait pas dans notre région encore. On est en train de voir. Mais ma réponse est que même si on descend, on dit 10 personnes qui pourront être dans l'intérieur et 25 à l'extérieur, c'est un contexte complètement différent que quand on avait commencé, qu'on avait dit 5 personnes et toute autre activité était fermée. Le limite ne touche pas les commerces, ne touche pas les restaurants, ne touche pas le cinéma, ne touche pas les événements organisés professionnels où on va avoir des personnes en place pour pour le superviser. Donc ça, à mon avis, c'est un contexte complètement différent qu'on restricte que les rassemblements privés, les parties privées. Même à ça, on pourrait avoir une party de 25 personnes à l'extérieur. Ceci qu'on ne pouvait pas avoir il y a 3 mois parce qu'on avait une limite de 5 personnes.
Great, Dr. Paul. Lots of comments now in the chat box asking about these new guidelines for testing and returning to school or daycare. So any idea about when these will be communicated with daycare providers, school administrators, and even parents? A lot of questions asking about that.
Well, we've already communicated them with the schools. We have protocols in place. We're constantly in communication with them. The new return to school protocol is aligned that way as well. So they should be the parents, the schools should be aware of these precautions. We're constantly talking to them. As a matter of fact, I'm meeting a French board tomorrow, and so we're constantly talking about those and reviewing those. And I have to say, however, and this is a caveat, let's say for some reason, we have a huge number of outbreaks and we're in the zone, we have to lock down. these may change. Some of these precautions may change, but for now, during this type of level that we have, this is the measures that we have, and we are working with the schools and the daycares. There are new daycare guidelines that are coming out very soon that will be aligning all together, because I know the daycare ones are a bit different, that there will be aligned. As a matter of fact, the ministry today told us they'll be out very soon. We're communicating that with the daycares, and we work with the daycares all the time, as long as our schools. So if they have any questions, this is the way we approach it with them. Au niveau de communication de l'approche, en effet, nous sommes en contact direct avec nos conseils scolaires, nos garderies aussi. Les protocoles que j'ai mentionnés tantôt au niveau de testing, de retour à l'école, tout ça est en train d'être communiqué avec les écoles. On travaille avec les écoles de façon étroite et ils vont être alignés pour les garderies aussi. Donc, tout est en train de toujours en discuter. Demain, j'en ai rendez-vous avec le directeur d'une des commissions scolaires francophones pour en discuter aussi. Et toujours, on a la communication pour qu'on puisse aligner à travers de toutes nos écoles. Nous avons 12 infirmières qui aussi font le support. Chose que je veux dire aussi, c'est que pour le moment, les protocoles que j'ai mentionnés tantôt, retour, pas besoin d'isoler en attendant les tests au niveau des membres de famille, tout ci pourrait changer si on a une augmentation importante des cas. Par contre, pour le moment, on utilise le protocole que j'ai mentionné tantôt.
Fantastic. So we're going to shift gears just a little bit. There's still lots of discussion, obviously, going on. We're still in the early days of the return to school, so we still got quite a few questions related to schools. So in keeping with the theme of bubbles, if you'd like, we did get a question about from a parent or sorry, an individual asking about whether or not it was possible to create bubbles in school classrooms, recognizing that kids are in the same class with their classmates all day long. The person asking the question is referring specifically more to like junior and senior kindergarten, where learning through play is very important. And right now, kids are kind of playing on their own in a classroom with their classmates who they're spending all their time. So I guess just looking for your feedback on this idea of creating school bubbles.
Actually, that idea was run by me by the medical officer of health from Leeds, and I agreed with it. In a situation where, for example, you have a large class and you can limit, like put kids 4 together on a table, and each child is their own bubble, and don't intermingle with others. You're actually creating small bubbles. So actually, that's a good idea. We've actually discussed it with the school boards. Some are actually implementing it. Some may not choose to do that, but that's a good idea as well, because you're limiting it. The trick is that as much as possible, you're limiting those kids with each other. Let's say there's 4 or 6 of them, or even 8, that they always play together and not try to mix with other cohorts. It's actually cohorting, and that's something that we discussed. Actually, we had a drawing. I remember her showing me a drawing of how that will work out in the classroom setting. La question est que si dans une classe, surtout maternelle ou maternelle, si on pourrait comme avoir 4 ou 5 enfants ensemble pour créer leur cercle social, qui pourront travailler ensemble dans une table pour faire des interactions, etc. Et en effet, c'est un des protocoles que nous avons discuté en mois de juin, juillet, je ne me souviens pas, avec l'autre médecin hygiéniste de Leeds Granville. On avait discuté avec 2 ou 3 conseils scolaires. C'est une autre approche qu'on pourrait faire, de mettre 4, 5, même 6, 7 enfants ensemble autour d'une table. Et ils sont leur cercle social, mais ce cercle social joue ensemble, mais il ne peut pas être mêlé avec les autres. Donc, si on est en classe de, disons, 20 enfants, on pourrait avoir 5 avec 4 ou quelque chose comme ça. Donc, ça, c'est une autre approche de faire. Et je pense que nous avons discuté avec les écoles et c'est une possibilité aussi.
Wonderful. So staying again a little bit in the school theme, but I think it's also about getting ready for fall. So I think a lot of people are anticipating that with winter coming, obviously, colder weather, we're wearing more clothing. And so when we're going places such as school, or if we're going to activities, whether it's like a sporting activity or things like that, where right now a lot of things like change rooms and lockers are restricted in terms of being able to use. That's not a problem when it's summer and we're wearing what we're going to wear. But with more clothing and more things being carried, like what are your thoughts on having the belongings in lockers or using more of the change rooms instead of having things with you, or for kids in the classroom, they'd be bringing their coats and their boots and things like that in the classroom?
That's a very good and practical question. And I think we've talked about that. And I think that we have to find out ways where lockers or other things could be used in a safe way, in a way that could be staggered, where you put one class at a time to go and get their things, where you stagger them, where you don't, you can find creative ways of doing that, because what else are you going to do? Even if you hang them in the classroom in the back somewhere, you still have to mingle, you still have to find somewhere to put these things, right? So I think those are logical solutions that we will be talking to school boards, because again, we have to be practical about it. And so there are ways of being able to stagger locker use, or stagger, going to a club, wherever you put, your winter clothes, because during pandemic. So yes, that's a very practical question. Donc, la question est qu'on est en train de... Là, l'été, on n'a pas beaucoup de vêtements, on n'a pas grand-chose à mettre dans un casier, mais au moment que l'hiver rentre, on va avoir des bottines, on va avoir des manteaux, etc. Qu'est-ce qu'on fait avec tout ça? Donc, ma réponse est qu'il y a des moyens qu'on pourrait mettre dans des casiers, ou dans les casiers, ou dans les locales spécifiques, pour ne pas l'envoyer dans la classe, mais avoir un système qui rassure une distance physique, et les enfants ne se mêlent pas avec les autres classes, de faire comme, OK, ce temps-ci, cette classe va aller chercher leur manteau à 3 heures, l'autre classe va le faire à 3h25, etc. Donc, il y a des moyens à le faire. On n'aura pas de choix, parce qu'en effet, on est en Canada, l'hiver s'en vient.
That's right. I don't know how excited everybody is to see snow on the ground, but let's enjoy the fall while it's still here. So play structures and parks. So these have been reopened in our municipalities for quite some time now. I think there's a resounding cry of joy from, I think, parents and children alike when play structures were reopened. And so we have a question from someone asking whether or not play structures at schools can be used, and if not, why?
Okay, we've the play structures have been opened, and we've shared that with the school boards. We've told them the issue is that it is very difficult to monitor and to disinfect playground structures with kids. And so what we've done in the outside of schools, we've got signs everywhere where kids can go and play, but make sure that you wash your hands before and after, because it's impossible to have somebody standing there all the time to go and clean, the slide or whatever it is. So those are more the challenges that the school. So there's no reason that a school board can't do that, but that depends on the individual school board's capacity to do that. But it's not, they cannot guarantee that they'll be there after every child using it and wiping it down, if that wouldn't be practical. So it's not that it's not allowed. Again, it's more of a practicality. But like I said, in play structures, in parks and public parks, we've spoken to municipalities. We've actually made signs for them that tell parents, please, if you're going to use them, make sure that you wash the child's hands, you disinfect and so on before and after use, those type of things. With some restrictions, don't go on if you're sick, all the routine things. So there should be no reason in schools unless they have, it more supervisory. And again, it's different in schools because they have a lot of kids running around. They have a lot of responsibilities. And so I can't speak for the schools, but from the point of view of the public health point of view, they're allowed to play on them. But again, there has to be some precautions in place, either making sure kids wash their hands or somebody wiping them down, which is not practical. La question, c'est une bonne question. Les structures de jeu au niveau des parcs, etc., est-ce que pourront être utilisées à l'école? Ma réponse est que une fois ils sont pas interdits, les enfants pourront en jouer. Aux parcs municipaux, ils peuvent le faire. Par contre, c'est très difficile pour les municipalités d'avoir quelqu'un là pour désinfecter toutes les structures à chaque fois qu'un enfant joue. Donc, nous avons des pancartes qu'on a données à travers de notre région, même chose à Ottawa, etc., que dit aux parents, OK, si votre enfant va jouer, il n'y a pas de personne qui va le désinfecter, mais une fois avant que votre enfant allait jouer, désinfecter les mains, etc. Et une fois que l'enfant a fini, laver les mains, ou etc., prendre les soins personnels. C'est le même principe aux écoles, mais les écoles sont au courant qu'ils pourront l'utiliser et on laisse la décision à chaque école. Mais encore, c'est une question de... c'est vraiment difficile de dire, oh, l'enfant a joué, a glissé, d'avoir quelqu'un pour tout désinfecter. C'est pour ça que c'est pratiquement impossible. Donc, on met l'importance sur les soins de santé et l'hygiène personnelle de santé publique.
Fantastic. So, Dr. Paul, we have about 5 minutes left, and we're going to finish things off with one last question that actually goes right back to our theme about gatherings. And so I'm going to say it in French because it comes from Monique Urtubise in French. Donc, she asks, si on fait un rassemblement intérieur en respectant les nombres, y a-t-il un avantage à se réunir dans le garage plutôt que dans la maison? So if I just ask the question in English for our listeners on the call, asking about if you're doing a gathering at your house while respecting all of the gathering numbers, is there an advantage to doing the gathering in your garage as opposed to your house?
Okay. J'imagine que la raison pour laquelle vous l'avez demandé, c'est parce que vous pouvez laisser les portes ouvertes de garage et pour laisser l'air rentrer. Donc oui, si c'est possible et si vous êtes capable, idéalement, le plus les fenêtres sont ouvertes, le plus de ventilation qui pourrait recirculer l'air et les gouttelettes de l'air, et j'imagine que toutes les autres précautions vont être prises. Donc, si on a un choix et on pourrait le faire, c'est logique que le plus les fenêtres sont ouvertes, et si vous avez des grandes portes de garage, c'est une grande ouverture, à ce moment-là, ce sera préférable ou idéal, mais je ne pense pas que ça serait pratique de le faire en hiver, parce que, et si vous me demandez pour ça, si vous avez l'intention de le faire avec les portes ouvertes. So the question really relates to, I'm presuming, that they can put, a certain number of people, say it's the same size as your living room, but if you put them in the garage, it really relates to the ability, I would presume, that you open the garage doors, and it's like huge windows, right? So that could cause more circulation and circulate the air and get rid of some of the droplets that may be in the air, although you should be physically distancing and masking and the other things. So I think that it's more of a ventilation issue, but if you can do it in garage, it takes it, that it's fine, and you can fit the number of people that are appropriate, physical distancing, that's excellent. Opening the garage door would bring in more air and ventilate the area more and get rid of, bring fresh air and circulate the droplets if there are any, aerosolized, because once they, so that's theoretically, that's great. However, I don't think you'd want to do that in the middle of, minus 38 degrees. So that would be your choice. And I think that would be the reason the question was asked.
Great. Thanks, Dr. Paul. I think that's a good segue to close things off. So I wonder, do you have any parting words as we start to look towards the fall and when we're talking about group activities, gatherings, anything to leave our listeners with?
I think that, regardless of what the numbers are, okay, and one of the other reasons that sometimes we want to decrease the number of gatherings is because I'll give you an example. If we're going to a gathering where there's like 30 or 40 people, there's a lot of people that you trace from that. And there's less people to trace if there's 10 people, so that's the advantage of it. But regardless of the numbers, we're not going to be going more indoors. And I do believe that you can safely meet if you respect the numbers, if you understand the difference between what your social bubble is and what you could be doing with your social bubble and what you should be doing outside of your social bubble. So just make sure that you do that. I think, again, one of the things that we've learned is making sure that people don't participate in those events if they're sick, if they have if they don't feel well, not to go. That's, to me, it's very important. And importantly, the more we do that and the more we're careful indoors, and the less we're going to propagate the virus and the less it's going to be in the community, and we're indirectly protecting both our schools and our long-term care facilities. Donc, en français, en sommaire, la raison pour laquelle on s'inquiète un petit peu, parce qu'on rentre on rentre dans l'intérieur avec le changement de température. Et à ce moment-là, ce serait très important de vraiment respecter les distances, respecter le port des masques au lieu intérieur et aussi de comprendre que la différence entre notre cercle social et les personnes qui sont en dehors de notre cercle social, n'importe quel le chiffre, soit c'est 10 ou 25, il fallait le respecter. Parce que en collectivité ensemble, surtout quand on rentre à l'école, le plus qu'on fait de distance, le moins le virus va se propager, le moins de virus va être dans la communauté et le moins le virus va avoir des chances de rentrer aux écoles. Donc, so we're in it right now. I think we can collectively make a difference in putting those numbers down, because we keep seeing those numbers go up provincially. We want them down. We want to keep them down, and enjoy ourselves at the same time. We can find a balance, a healthy balance between the two.
Thank you, Dr. Paul, and thank you for everyone who joined us tonight. If we didn't get to your question, we'll try to make sure that someone can follow up. Donc, merci à tout le monde qui se sont joints à nous. Si on n'a pas eu la chance de répondre à votre question, on va essayer de faire un suivi avec vous dans un bref délai. So, good evening and have a good night, everyone. Bonne soirée.
Bonsoir.